Like to welcome in Dr. Jason Stein from MedStar. Doctor, welcome. He is a shoulder and elbow surgeon, and that's what we'd like to talk about today because Tommy John surgery, doctor, I'm old enough to remember I covered Tommy John when he pitched for the Dodgers in the 77 and 78 World Series. And he and Dr. Job are the two that started all this. Just a little bit about the history. It's hard to believe, but it's been almost 50 years now.
Yeah, it has. I mean, it's sort of an incredible story, where Dr. Job was able to kind of come up with this new procedure and get him back to playing. I mean, and he had a great rest of his career, after he had that surgery done, which is really just incredible.
Yeah, I looked it up. He won 10 games the year after he had the surgery. And the next 4 years prior to that, he averaged 20 wins a season. So everybody was on board. Prior to that, it was pretty much a baseball death sentence, wasn't it? If you tore your UCL.
It was, yeah. I mean, I think we have to remember though. There's a spectrum of injuries to the UCL. So most players may have a slight injury to that or some irritation, and they do fine. But if they tear it, or if it gets stretched so much that it's sort of incompetent, then those, they're not able to pitch with the same velocity that they were able to before.
Give us a little bit in layman's terms, the procedure, what you actually do when you go in and fix the UCL.
Yeah, so the UCL is on the inside part of the elbow, so it's right here. And actually, if you look at your skin, it only goes about this far. It's very small, and it's kind of like, think about it like a rubber band on this part of the elbow. All right. And most of us don't even need that rubber band. The elbow is a very stable joint. It kind of moves around, and you don't really hear about elbow dislocations like you hear about shoulder dislocations, except for maybe in wrestlers and things like that. Mm-hmm. So those ligaments for most of us aren't that important. But for pitchers who put a tremendous amount of sort of velocity on their arms and that kind of bends their elbow out, that rubber band can be helpful, And so what you do when you do the surgery is there's this little bump here on the inside part of your elbow. You'll make a little incision from about here to here, okay? And there's some muscle right over this, and then your ulnar nerve is right here. And you have to be very careful about the ulnar nerve. And you kind of split the muscle, and that'll get you right down to the joint itself. And that ligament, as I said, goes from about here to here. So what a lot of us will do is some people will have an extra little tendon in their forearm. And so you'll take that little tendon out and you'll use that as a new ligament. There's a lot of different techniques, but a pretty common one, and the one that I use, is you'll drill a little hole over here, and then you drill a little hole on the bone on the other side of the joint. And then you take that tendon that you took out of the wrist and you'll put it into those two little holes and tighten it down. And you put two little screws over the top of it. And done, and then it's a year-long recovery, basically. So, the surgeon gets the easy part, the patient gets the hard part.
Yeah. Well, a major league pitcher has team doctors and trainers, but how about the amateur that undergoes this and the recovery process? How do you offer advice for somebody like that?
Yeah, well, I think I really thank you for bringing that up, because I think the most important thing to the average person, the person watching this show, is that thinking about the elite athlete, the major league pitcher, even the college level pitcher is very different than thinking about probably most of you that are watching this right now, who have maybe an adolescent, that plays baseball, or you yourself sort of play weekend baseball. This surgery is not for those people. And actually, there's a lot of good data on adolescents that undergo this surgery. They don't tend to return to sport, So younger people that get this injury, remember, it's not going to affect their regular life. They're still going to be able to play other positions in baseball. It's generally just going to affect their ability to pitch. And so rather than, if you're 14, undergoing a surgery that's going to take a year to recover, of which you don't have a great, chance of returning to high-level pitching, you're better off changing positions. So I think I really caution parents on thinking that, my son or my daughter, if they're a softball player, have hurt this ligament, I'm going to go ahead and get this fixed, and they're going to be better than they were before. Now for college-level pitchers, minor league pitchers, major league pitchers, The rehab is about the same. I mean, obviously the majors have sort of these exceptional trainers and stuff like that, but we take care of a lot of college players around town, and they have great resources in their college systems with the trainers, and they work on that. You basically have to get your range of motion back after the surgery, because stiffness can certainly be a problem. And then it's a progressive sort of training program with a good with good throwing program, and then sort of slowly transitioning you back into pitching.
Dr. Stein, thanks for the insight. Appreciate it.
You got it.